My name is Dr. Bokman. I am a board certified and fellowship trained oculofacial plastic surgeon. The specialties I focus on are face and neck lifting. Specifically, I specialize in the deep plane technique of the face and neck. I also specialize in brow lifts, eyelid lifts like upper and lower blepharoplasty, as well as lip lifts. And I even do some reconstructive work and revision work on patients. The typical patient that I see is, someone who takes care of themselves, but they're looking for just a refreshed look, or they've, aged. They feel like they don't recognize themselves in the mirror anymore, and they want to look again, like they did 20 years ago, which we can achieve with surgery and other techniques. So I'm all about natural results. So I like, patients looking natural, not like they've been done. And I think the other thing that differentiates me is my training. I trained in LA for all of residency and all of my 2-year fellowship. So I was able to work with some of the best surgeons in Beverly Hills and LA, even with the doctors on the show Botched. And so that kind of helped me just build my skill set and then bring what's best to other places like Sarasota. The biggest misconception that patients have about plastic surgery is that you are going to look done. And patients nowadays, especially in my hands, are not going to look done. They're going to look natural. They're going to look like their 20-year-old self. And I have patients say that. I have spouses say that about my patients. Wow, you look like you did 20 or 30 years ago. And that brings me a lot of joy too. The advice that I would give someone who's considering plastic surgery is be critical about looking at a doctor's before and after photos. So a lot of photos nowadays are meticulously photoshopped, and you have to really look, are there background changes, are there smoothing effects that you can sort of tell when you look at them closer. It's also nice to ask about testimonials from the patients that have already been done by that physician. Some of the new and evolving techniques that are coming out are new ways to make facelift surgery and neck lift surgery longer lasting and minimally invasive. The deep plane technique, and specifically not the SMAS or the skin only approach, it's the deep plane to lifting the face, results in longer lasting results with less downtime. And my patients are experiencing that. Some of them go back to work after a week after having a face and a neck lift, and they're surprised at how little pain and bruising there was. Success for me, for my patients, looks like them just having a result that they're completely thrilled with. Say they had an eyelid lift of the upper and lower lids. They're smooth, there's no extra skin hanging, they feel like they achieved more than what they even expected. And in terms of facelifting, just having that jawline that's really tight, they have no jowl now, no neck bands, and they're just like extremely over the moon with their results, then that makes me happy. Some of my patients come in and they've had a bad experience with plastic surgery. They've been botched, and it gives me a lot of joy to be able to fix them, to offer them a solution that they may have thought was not possible. And afterwards, even in the early post-op period when they're still healing and they see themselves again, they feel like they're not botched or messed up anymore. The hope has re-entered their eyes, they're glowing now. That gives me a lot of joy to help these patients that have otherwise thought there was no solution. We exceeded their expectations and they got that spark back. Some of the favorite things that we hear from our patients is that they're getting carded again. They go to like a restaurant or something and order a drink and they need to be carded because they look so good and young. I had a patient who was pulled over by a police officer and looked at their license and said, "You're not really this age, like this old." And she was like, "Yes." Yeah, she was getting pulled over. I think it is our exceptional team here at Azul that gives a patient a unique experience here. Exceptional care. They are with you every step of the way. They are extremely nice and caring and even give their cell phone numbers out. Patients choose Azul because we offer the best of the best care. It's the best physicians, the best injectors, and the best office staff. The people behind the scenes are really working hard to make sure everyone is happy and that we do a great job, that we do the best job. Here at Azul, we have patients who are so happy that we end up seeing their whole, family, all their family members, and even their friends. I've seen whole neighborhoods at one point because they're all referring and saying she did a great job, you should go see her. And so that kind of just like is a domino effect. So if you're considering plastic or reconstructive surgery, I would love to be your doctor. Please come see us for a free consultation at Azul. It is where? I just wanted to see what I look like with a bun. No, you guys can't listen to me. Now that I saw you. Quiet on the set. Yeah. What was the question again? Can you say it? No, this is good. Now I'm going to be laughing. I am like dragging. See you soon. That sounds scripted.